All right, so today I'll just be talking about the role of the speech language pathologist and kind of what we do and how we treat kiddos with autism. Next slide. So we'll take a look at, understanding the different areas that SLPs treat and assess, kind of differential diagnosis specific to autism, the communication deficits that we see in kids with autism, and just kind of our role working with kids and families. Next slide. So what is speech language pathology? I love this graphic. We speech language pathologists love things like this. So it shows everything we do. But really, we're looking at a person's speech or their ability to articulate different sounds, their language, which can be the receptive and expressive, either through written or spoken means. And then we're looking at the disease process or the science and cause of these things and integrating all this information so that we can treat individuals with speech and language disorders. Next slide. So what do? We treat lots of different things. So we look at speech and language disorders, fluency, cognitive communication and social communication, voice and resonance disorders, feeding and swallowing, auditory habilitation, and then different means of communication like augmentative and alternative communication. Next slide. So I'll just go in. I want to talk about each of these a little bit because we don't just, people will ask, what does a speech therapist do? We don't just work on S's, we work on lots of different things. Yeah, that next slide, Lindsay. Thanks. So speech disorders, there can be different things we do. So articulation disorders are your ability to produce different types of sounds. Phonological disorders or rule-based errors, they can affect like an entire sound class in a different way than just an articulation disorder does. We look at fluency, which can be stuttering or cluttering, voice and resonance, which is your vocal quality, the pitch, the loudness, your resonance. We can see differences with kids with autism in this area. Apraxia, which is a motor planning and coordination issue, which I'll talk a little bit about later too. Dysarthria, motor weakness issue that can impact speech, and then issues related to like cleft lip and palate. As far as language disorders, like I said, they can be receptive or expressive, spoken or written, and they can affect all areas of language. So your morphology or the way you're putting words together, your grammar, your vocabulary. Obviously related to autism is that language function or our social pragmatic language, right? Which we see not just in autism, but in individuals with selective mutism or social communication disorder. We also look at literacy and pre-reading skills, and then aphasia would fall under there too, and there's been a brain insult that can affect speaking or their comprehension skills. Next slide. We also treat hearing disorders or hard of hearing issues, central auditory processing. We look at cognitive communication, and kind of those executive functioning skills, prosodic differences, right, which we see in individuals with autism, where the tone, the stress pattern, the rate of speech, or that pausing and rhythm of speech is impacted. And we also treat feeding and swallowing disorders, so dysphagia, feeding, oral motor training, or things like tongue thrust. And then again, we look at augmentative and alternative communication needs too. So when I first was trained in autism assessment, this is how we conceptualize autism. And I just kind of like to remember this is how we used to do it. And explaining it to parents, I never felt good about it. It was always like, I don't like how it's talked about as low functioning or high functioning. I didn't like trying to explain this umbrella thing. It was like, it falls under here. Because parents always had lots of questions that sometimes I felt like I wasn't able to answer. Can you go to the next slide? So I really like that we have more of this holistic conceptualization now, right? And like this slide says, what people think autism looks like, what it can actually look like. And each individual with autism is impacted in different ways in different areas. And that second little graph that has the two little circles, I really like to show this to parents to help them understand, like, listen, your child experiences more challenges in, with their sensory issues or with, their social differences. And we really moved away from using, high and low functioning terms. Those aren't helpful. They're really harmful to use. Next slide. So when we look at autism, right, I'm going to be focusing in on these social communication deficits, but really those deficits impact all these other areas, and those other areas impact your social communication. Next slide. So, the American Speech and Language Hearing Association goes in and talks about all of these areas. And so I just want to go through and talk about the areas in autism that we may look at and be helpful in treating. So the first, obviously, is that joint attention. Some of these kiddos can have different body orientation when they're with other people. I have kids that I test that are completely turned away from me. They don't know how to orient just to be with me. And they often can be focused on the objects that we're working with and not the person. And they'll have difficulty directing attention or following if I'm trying to direct their attention to something. And they can have difficulty seeking comfort or being comforted or understanding the emotions of others, which I often see when we're assessing them. For social emotional reciprocity, they can have difficulty making bids and responding to bids from others. Difficulty engaging in and maintaining those social interactions or play routines. This is a big area parents will talk about, right? Where it's like they want to play with their child, they want to be engaged in these little games. Sometimes these kids just struggle to kind of follow those routines or to try to maintain them. And they struggle to manage communication breakdowns. And in our little kids, we might see things like tantrums or just withdrawal when they're unsure what to do when that happens. And I know we're focused on our younger kids, but we also look at social cognition, especially in our older kids, which is just that difficulty understanding and managing emotions, thinking about another person's perspective, and developing kind of appropriate social behaviors. Next slide. So for the language and language related cognitive differences that we see, there can be delayed or different acquisition of language or an odd use of language. So we know the parents that come in, right, and talk about how they had words and then they've lost words. Sometimes what I see is just intermittent use of words. So the parent will say, they were saying these words. They popped out the other day and said elephant, and I haven't heard that word again. Or they said mom and dad, but I haven't heard that for 2 months now. So it just can be an odd developmental progression. And a lot of times they'll have nouns and attribute words that they're using, but they struggle to use other forms of language like verbs. We can see echolalia, that scripting from shows or songs or repetitive and rigid language. And I always ask about this because kids, when I'm working with kids, they might be saying the same thing over and over again. Or the parent will say, oh, when they say that from that song, it means they want something to eat. So they're using language in odd ways. And I always ask, where is that from? Is that from a show or a song? Like, tell me more about that. We see differences in their use and understanding of nonverbal and verbal communication. So, right, we talk about this a lot in here, just that difficulty integrating and coordinating their eye contact, their facial expressions, and their gestures. And it really is a quality and quantity issue, right? I see kids all the time that are pointing or they're using eye contact, but it's super intense and not modulated. They really struggle to put those things together. And this can be for kids that are verbal or nonverbal. And they'll also struggle to understand those behaviors in other people. We can see just a different use of gestures and requesting where they might be pushing and pulling or using the human beings in their home as tools to get the things that they want instead of using language or gestures that would be more appropriate. And then another thing we see, which I always think is interesting, is that their expressive language is often greater than their receptive language. So for neurotypical kids, you would see the opposite, where your receptive language is often a little higher than your expressive language. But for kids with autism, sometimes it's the opposite. Next slide. We also see vocal development differences. So they'll have different responses to another person's vocalizations. And I've had parents tell me all kinds of things kids do when they will call their name or say something to them. And then those odd vocal productions that we can see with apraxia. So like I said, apraxia is a motor planning issue. So we can see kids that it's called groping for movement, where they look like they're trying to form a sound, but they can't quite get the motor plan correct, or their vowels can be really odd, or they're using speech sounds that just you wouldn't expect for their age. We can see that prosody can be really different, where it sounds robotic or flat or odd, right? The way that their speech sounds. We also look at um, symbolic play differences, right? Just that acquisition of functional and conventional use of objects can be different. So kids that take a car and would roll it back and forth, maybe a child with autism does something really different. They're rubbing it on their face or checking it out in different ways, not playing with it in the way that it's intended to be played with. And we see rigid or repetitive play, and just they really can really struggle with that cooperative play. Next slide. Some of the stuff on this slide, it pertains a little bit more to older kids, and I wanted it on here because I assess kids from like 2 years old to adults that are 65 years old. And in our older kids, those conversation differences really become more apparent, right? So that difficulty understanding and knowing how much information to offer, can struggle with turn taking or maintaining a topic, or they're maintaining a topic of interest that is odd for the conversation or goes on for too long. A lot of times they're sharing a lot of information, but not asking for information or following up when the other person offers information. And repairing those breakdowns can be really difficult, or clarifying something. A lot of the older kids I see with autism get really upset if you ask them to clarify something, like, well, I just told you that. And I'm like, I know, but I just want to understand more. And then difficulty understanding non-literal language. This is a big one because of that rigid thinking, right? And that cognitive flexibility that can become so rigid. They really struggle with that language area. And then with literacy, just difficulty with reading for comprehension, understanding narratives or expository text, or summarizing the main point and providing information through writing, which can come in, for IEPs and stuff, which is a whole other thing we could talk about, just getting accommodations for those kinds of things. And then executive functioning differences, right? Flexibility, difficulty with problem solving, and planning and sequencing. And with our little ones, that sequencing can really impact their day. Them knowing the routine of a day, how to do different things like getting ready in the morning, can become really difficult. And that's something we can work on. And then just that inhibition. Next slide. We also look at sensory and feeding challenges, right? So we know that many kids with autism are experiencing different types of responsiveness to sensory stimuli. I always talk to parents about like how their motor's running. Is it high or is it running low? And what are the things that are impacting that? And then obviously the difficulty with food, and that can be based on presentation, texture type. I always dig in more in the feeding area. So if a parent, is telling you, yeah, they're a pretty good eater, I always ask, well, tell me what that looks like. What types of food are they eating? Do they have to have the same thing presented the same each way? A lot of little kids with autism don't like to use utensils because it's difficult motorically, but also they just haven't figured out the function of it. So parents will be like, they don't like to use a spoon and a fork. They only want to eat with their hands. And then for the behavioral and emotional challenges, this is an area where like I refer out for different things, but this directly impacts and is affected by your communication, right? If you lack communication skills, those behavioral and emotional challenges can really go through the roof, right? I see Julie nodding her head. Next slide. So what do I see in practice? Like I said, I've been doing this for a really long time. And I was like, what are some of the main things I see when I have these kids in front of me? A lot of the little kids are really interested in things like letters, numbers, colors, right? They really like to categorize those. And these are things that parents are super proud of. They're like, they know all their letters, they know all their ABCs. And I always applaud that. I'm like, that's fantastic that they know those things, but how are they functionally communicating is the next question I always ask. Like, it's great they know those things, but tell me how they're getting through their day. And like I mentioned, the hyperlexia, I'll have 3-year-old kids that are reading words, and it's not that they're comprehending them, but they're able to read them. They will have interest in specific objects or parts of objects. I had a kid the other day that's really interested in fake plants. So his mom had asked if they could take a leaf off our fake plant, and then he carried that around with him the whole time he was here. We see that odd visual gazing, right? The visual regarding, where they're holding things up to look at it oddly. The best thing you can do with these little adorable children is give them a mirror and see what they do with the mirror and how they interact with it. It's fascinating. It's like my favorite thing to do. Um, they're usually very picky, and a lot of times, at 2 years old, the parent will be like, this isn't really a problem yet. And then a lot of times it becomes a problem. They start restricting that diet. They start narrowing it down to just kind of a limited amount of things that they're eating. And they do often use my hand as a tool, or they try to use their parents, or they'll just refuse to engage with the objects themselves. So I'll have to be the one picking them up and manipulating them. Lots of the kids I'm with like to lick things or mouth them or rub them on their skin or just have them in their hands so they can feel them. And then that odd finger posturing. So they'll be crossing their fingers, holding their arms in odd ways, moving their fingers around in interesting ways, flexing their body back to look at the ceiling, tiptoe walking, things like that. Next slide. I know this is like a big slide. I didn't know how to not put all of this on here. But I think it's important to know they struggle with pronouns. So when these kids are in front of you, sometimes they're talking about themselves in the third person. They don't understand things like my turn, your turn, that reflexive nature of pronouns. And that might be something where you're like, well, that's odd that they are not understanding that. They can have difficulty responding to their own name or even recognizing it, or the name of, familiar people like mom and dad. They can struggle to share and show things. It's my favorite thing to try to get things away from kids with autism, because it really turns into like they think you are there to like just ruin their day and take things away from them. They haven't begun to understand that you can show and share things and get them back. They struggle to ask and answer. They can struggle to ask and answer questions or follow directions. So a lot of times parents will be like, yeah, they can follow like basic routines at home, like time to eat or time for bed. But outside of that, those routines, or if those routines are changed in any way, then they can really struggle. We see that odd intonation, like I talked about before, or echolalia, repetitive or scripted language, and odd or delayed speech development. It like never ceases to amaze me how sometimes these kids their developmental progression of acquiring speech sounds can just be different. So they might be producing later developing sounds instead of kind of the sounds you would expect to hear at their age. Just those big struggles with joint attention. A lot of times in here, they're directing affect at the objects they're playing with, just not at me. And then shared enjoyment or play, that relational or symbolic play and turn taking. And they can struggle to understand cause and effect, which parents will talk about, right? And I have lots of toys in here that are cause and effect toys so that they can start to learn those things. But one of the things that these kiddos can have trouble with is imitating, right? And so one of the big things we need them to do in therapy is imitate. So I always tell parents, like, start with like body imitation at home, finger plays and things like that, so that we can get down to them being able to imitate like speech and language stuff. And then I already talked about just the difficulty being comforted. I always ask parents about this because they'll be like, yeah, it can take 2 and 3 hours to calm them down, or they don't want to hug when they're upset. So I always ask about that. Next slide. So as far as assessment, differential diagnosis, in the clinic that I'm in, we're obviously looking at a variety of things when these kids come in, but specific to just a speech language pathologist, the things we might be ruling out are that social communication disorder, so that difficulty understanding social rules, implicit social behaviors, but it doesn't include, the RRBs that we talk about with autism. With selective mutism, this is a big one, I feel like, because autism can look a lot like selective mutism. So what we see usually is that avoidance of social communication and interaction with a high level of anxiety. And usually these kids, like at home, are conversing and talking just fine with their family, but in different environments, they really shut down. Obviously, the autism spectrum disorder we would be looking at. And then it's important to just know those social differences in kids with trauma or neglect, any cultural differences. And then I'm obviously a big proponent of language with evaluations within like a comprehensive team assessment. So you can kind of look at everything. Next slide. We make referrals for lots of different things as speech therapists. Hearing evaluations, OT and PT, pediatric dentistry. I have lots of kids that have like overbite and underbites that can impact their speech development. Pulmonology and GI, neurology. If I see any seizure-like behavior, I want to refer genetic testing. ENTs, I'm taking a peek in these kids' mouths too. Their tonsils can be enlarged. They can have nasality issues like hypo or hypernasality, vocal fold concerns. I want to make sure their palate is functioning correctly. So if I see any issues there, I'll refer them to ENT. And then obviously the behavioral intervention counseling is huge. We refer for psych and neuropsych testing, and then med management. Next slide. So as far as, the incidence of this, it's estimated about 63% of kids diagnosed with ASD will have language impairment, right? And these can affect their social pragmatic language, their use of this type of language, but we see struggles in other areas too. Like I said, with the way they're putting words together, their grammar, their vocabulary, and we'll see that odd or formal use of language or just idiosyncratic language use. And it's not that they have sometimes a language disorder, it's just their language has been impacted by their autism. And then, like I said, apraxia of speech can impact 2/3 of children initially diagnosed with ASD. I think it's really important to understand the difference between boys and girls, especially through their lifespan. We see these differences. I love that I assess across the lifespan because I see differences in boys and girls and when these symptoms of autism can kind of present themselves. But this study looked at little kids, and just girls with ASD tended to stay closer to their peers, were more, able to capitalize on social opportunities. They spent more time playing and engaged and talking. And they tend to use more compensatory strategies and behaviors to kind of gain access and be social with their peers. What they found was boys tended to play more alone than participating with others and spent more time wandering than talking with other kids. Next slide. So, like I said, I am a big believer in comprehensive multidisciplinary assessment to look at these kiddos and look at the whole system. To determine their strength in different areas and to help inform their treatment plan. And whether or not they've been diagnosed with autism or any other neurodevelopmental condition, they can be engaged in services. They don't need a diagnosis to start working on this stuff. Next slide.
Jami, I wonder, speaking of diagnosis, so Alana had a question in the chat, if you don't mind. So what are your thoughts about social communication disorder as a standalone diagnosis?
Yeah.
Sense is that it's merely a downstream result of an early language disorder. Some ASD experts and providers who I know will not diagnose it. However, I realize that SLPs may diagnose it as a way to target intervention.
Yeah, I'm trying to say this appropriately. I hate social communication disorder. I do think it's a downstream result. So I'm trying to think, we have maybe diagnosed that a couple of times. I don't diagnose that often. That's what I'll say.
Thanks, Jami. Okay.
Yeah. For treatment, it's super important to know. The reason I like multidisciplinary assessment is I get to know where their cognition is. I get to know how adaptively they're functioning, right? And so it really helps inform their treatment plan and kind of what treatment interventions I want to use. I like therapy to be family-centered. We use lots of different treatment modalities as SLPs. I listed a few here, but there's lots of things that we do. Next slide. I'm not going to go into depth on AAC devices because I think we have a session later on that'll be talking about this a little bit more. But there's a variety of things out there to use, which are great, from low tech to high tech options. And even on iPads now, there's some really great programs you can use. Next slide. Things that I really like that are simple for families to use and to get their hands on are picture systems. You can see the binder there. You can have different sections for different areas of life, visual schedules. And so the bottom left, right, has that routine for the morning, just helping them know these are the things I do when I get up. And on the right is a social story. I love social stories. You can write them for anything. They're so great for transitioning. And they're just lovely. And they're great for kids that don't have autism, kids that are anxious and need a social story about getting on an airplane and going on a trip. And then I use lots of sign language. So visual. It's less what's the word I want? I don't know. It's just great for kids with autism. Next slide.
Jamie, if you're game for another question related. So when is
Yeah.
an eye gaze AAC appropriate to use? Elena says she gets this question a lot.
Yeah. I mean, I think that, Elena, I've only seen the eye gaze systems used with like individuals with like pretty severe cerebral palsy, things like that. I haven't seen or used a lot of the eye gaze systems. Yeah, or motor impairments, right, that you would see with CP. Yep. So our role is really just to complete a thorough assessment, determine goals and treatment modalities. We want to understand the difference between girls and boys with ASD and any cultural differences. We want to refer for other services and specialties. We love to collaborate with other services like speech, OT, and PTs. I feel like we love doing that stuff. So I'm always doing that. We want to educate families and caregivers about speech and language development and autism and the available services, and just be an advocate for the child and their family. Next slide. Oh, yeah, thanks. And how do we help parents? Parents come in here in all different states. Some parents are seeking information and are really excited to kind of figure out what they can do to help their child. Some parents are grieving what's happening, and some parents are disinterested. We have parents that come in and are like, I don't know why I'm here. My doctor just told me I need to come get this done. So you want to meet them where they're at and understand how they're feeling, where they're at with this process. I'm always checking in with them about how their child's doing, how they themselves are doing, and offering resources. Sometimes I don't offer any resources because they just need a break from what's happening. I tell them to take a break. I always ask what goals they want to work on. I do my little test. I decide what treatment goals I'm going to do, but sometimes the parents have really specific things that are meaningful to them or to their family that they want included in these goals. So I always include that stuff. We set goals so we can measure progress and outcomes, and we just support them along the way. Next slide. This is what I tell parents all the time when parents are like, ooh, I don't know. Like, our brains and our communication skills are like rubber bands. They're meant to be stretched and used. And parents are awesome, right? They're super skilled at anticipating their child's wants and needs. But their kids need those opportunities to stretch and learn and practice new skills and to practice the learned skills that we're trying to teach them. So, speech language pathologists, we are skilled at assessing and treating for social pragmatic language and assessing for autism. And often parents are noticing these differences in their child's development, right? And they're going to start asking questions to all of you. And my best advice is to act early. Early intervention at the first sign of this improves the outcomes for these children. Please refer them. If there's any question, any concern about their speech and language development or their overall development, get them assessed so we can see what's going on. My favorite thing to tell parents is, yeah, they're right on track. Things look great. So there's resources down below, but that's it.
Great. Thank you, Jamie. And you did, oops, I want to do that. Jamie has several resources that are included in this. So thank you so much.
Yeah.
We did have another question from Tom. Can you touch on the Gestalt language style in girls?
I don't know if I can directly talk about that. What I know about it and what I have seen, I typically see boys using more of that scripted, like Gestalt language learning style. I probably can't speak to that a whole lot, Tom. But I'm happy to look it up and find out.
Thanks, Jami. And then from Angie Bouchane, thank you. So do you have any guidance on how often I think SLP sessions should occur or be effective?
Yeah. I know that with the ESDM stuff, it's a lot more frequent and over a shorter period of time. But for just traditional, what most of us are doing right now, I like to see kids 2 times a week for 45-minute sessions if I can. But it depends on the family. It depends on the family's follow through with things, and how just their resource availability to work on this stuff at home, because that can be a lot too. So it kind of depends and I change it.
Jami, building on that, can you talk a little bit about how that follow-up at home is so crucial? Because what these folks can do is help support parents in doing that follow-up at home. But
yeah,
every kiddo that I've worked with an AAC device, the ability for that to work out really well for the child and become adopted and be effective is almost directly related to how much the parents are invested in using it at home. So I wonder if you
agreed.
might talk about that.
Yes. So I have very mixed feelings about AAC. It's a wonderful tool, but if it's only being used in really limited ways, or like you said, Julie, like I think of it like underwear. You wouldn't leave the house without underwear on. You can't leave or go anywhere without that AAC device. It goes everywhere. It's used for everything, and not just requesting. Often those get right. They start just becoming this thing to request. Those, though, there are many parts of language and many things that we are using language for. It's not just requesting. So I talk to parents about, listen, think about the conversation we're having right now, all the different things you're asking me about, we're talking about, you're commenting on things. That AAC device needs to be used in the same way, to comment, to ask and answer questions, to request, to just say funny things like we do when we talk to each other. So I've seen those not used in super appropriate ways, but yeah, it literally has to be glued to them. It has to be with them everywhere, every time they're going to communicate.
Great. Jami, just so wonderful throughout your presentation. You had such great examples woven in. Thank you. If we have other questions, now's a great chance to ask those. Elena, thanks.
So I'm wondering, Jami, to the best of your ability, I'm not expecting you to be a wizard. So, I know kind of one of the themes that we've talked about as part of the ECHO is kind of some of the pattern recognition we look for in autism. And I think you gave some really great examples of like speech and language pattern recognition that you might look for in a child who may have autism or does have autism. We've talked a little bit about kind of the object-focused mind versus the social-focused mind, and in autism, in a very simplistic way, we might, really conceptualize autism as being more object theme focused and less social focused.
Mm-hmm.
One thing I sometimes try to explain to families is, what does language have to do with autism, and why is language such an area of difference or maybe difficulty for individuals on the autism spectrum? I know it's one area, and we all look at it, that I really, really heavily look at. and try to understand in terms of the pattern and if it seems to be consistent with autism or not. So is there any kind of general spiel that you give to families about why is language an area of relative difficulty for those on the autism spectrum?
Yeah, I think about it like learning your numbers or your ABCs, right? It's very explicit and straightforward to learn that. When we talk about social language, there's lots of explicit social behavior we do, right? Say thank you when you're given something, say hi when you talk to someone. But there's a lot of implicit things that happen when we socially communicate that we aren't teaching our children. They're picking up on these things, right? Kids with autism are not able to easily pick up on that stuff. And I think it starts from the beginning, right? If your joint attention is poor and you're not paying attention to the things in your environment, the people in your environment, you are not picking up on these, sometimes even the explicit things you're not picking up on. So I always tell parents, there's a lot of the things that I'm going to go in and teach, I'm going to turn all the implicit things into explicit things, but there's still gray area in those. What do you do when you're talking with a friend and you're going on and on about, they ask you, what grade you're in, and do you have any friends? And the kid lists out every kid in their class from first through third grade, right? How do you tell someone, no, that's not what we do? They just want to know a bit of information. So there's so much implicit teaching and knowledge that has to happen, and breaking down those things for parents. Some of the tests that I give break some of that down, and parents will be like, you're asking them questions like I never even would have thought of that, because those are just things I do. And I'm like, right, those are just things we do. We often aren't talking about these things unless there's a problem.
Jami, we had another question come in. So when kids are hearing and learning two languages, how much leeway do you give with some of the typical milestones for language development?
Yeah. For those dual language learners, I would say until about 7 or 8 years old, I am heavily taking into consideration that second language. And, are the kids, have they transitioned into school where that's just English speaking? There's a lot to consider there with that. But I think, and I wish, right, the ethical thing to do would be to evaluate a child in both languages. Often that can't happen, or we don't have the resources to do that. But there are big disclaimers in my evaluations when I evaluate a kid that's a dual language learner. I'm like, listen, we don't yet know how that language, because you would expect them to lag behind a little bit if they're a dual language learner.
Jami, what do you think about Miss Rachel? I get questions all the time about people who, parents, like, is it okay to set the child in front of a screen with like an SLP on the screen, or someone like Miss Rachel who's entertaining them? And what are your thoughts on that for like the downtime that the kid has? Or I get questions from parents all the time about, is it okay to put them in front of those programs?
What do I think about that? I think for some kids it's okay, and for some kids, I don't know, we all have our, the other thing, we talk about all these behaviors, right? Like, we're all doing pieces and parts of these things. We all have sensory things that bother us. We all have things that we're super into and interested in. We all have downtime where we want to check out and be able to just get on our phone, get on our tablet. But yes, I think some of those things are okay. And a lot of parents are trying to put their kids in front of like learning shows or things like that. And I do think it's okay. I think a little bit of that is okay. And I tell parents, if the best thing it does is give you a break for a little bit, it's okay. It will be okay.
Jami, I have another question for you. So if a PCP is looking to make that recommendation for their patients, are there particular questions that they can tell their parents to ask, or what are the things that someone should be looking for when selecting an appropriate SLP to work with an autistic child?
Well, it's a really good question. One of the things I would love to see when those referrals are made is that you want their social language evaluated. So if you're referring a kid for a speech and language evaluation, but the underlying concern is autism, you want to specify that you want their social language evaluated, because sometimes a speech therapist is just going to do a basic language evaluation that's looking at their receptive and expressive language, which is good because a lot of these kids, like I talked about, will have a delay in that language. But really what we want to know, right, is how the social language is developing and what's happening there. So not every speech therapist is taking a look at that. So that's one thing I would do. I would specify that. And then I would ask, if you have been referred somewhere for services, I would ask, do your therapists have experience treating kids with autism and kind of what those treatment modalities look like? You can ask those questions as a parent, and I would.
Great. Thanks for others chiming in, kind of continuing that dual language conversation in the chat there. Any other questions or comments related to speech language pathology for Jami, or broader questions for this series and our panelists?
I have a quick question.
Thanks, Kate.
I seem to get like a 12-year-old, 10-year-old there, and they have a real hard time with transitions. Like, we're not doing sports today. You know, we have to go to the dentist instead.
Yep.
Are there any, like, I'm looking at the cards, I Googled them. Are there any
Yes.
like things that from a speech language part that I could empower the parents with to?
Yes, 100%. This is the stuff I love. So yes, a visual schedule would be great, right? So putting down the little cards on the day or writing for an older child. What's great about this too is a lot of times these kids, as they're transitioning into adolescence and older, they're having trouble organizing and kind of maintaining the things of their day. And those visual schedules can transition really well into a planner for older kids, which I love. So I have parents start that stuff early. We start calendars early. I have them put up a big calendar that just reminds them of big activities that are coming. And then we use smaller, like a planner or that visual schedule for daily or weekly things that are happening. And time concepts can be really tricky for kids with autism. So I have parents go back and talk about things like, remember last week how we went to the zoo? And this week we're doing this, and next week. So they start understanding time, because time can be tricky and cause a lot of issues, and just hardship for those kids.
Jami, another question. How much speech therapy can be done in the public school setting? Sometimes parents feel like it's not enough, and in some cases, I'm not sure that it is.
Yeah. I don't know that I know how much can be done, but I ask for the max. So I used to go to IEP meetings. I don't really anymore. I would ask, what's the max allowed for speech therapy? And then a lot of times they'll want to put them in groups, which is fine, but I always ask for some individual time too. Imagine, if your kid's going to speech therapy at school, they're being pulled out for 20 minutes and they're in a group of 4. They're getting about 5 minutes of therapy, right? So it's things to think about. And it's true what they say, the squeaky wheel gets the grease. And I tell parents to ask and ask and ask and ask. Like they're the ones with the power in the room, even though it's super intimidating to walk into those meetings and to have all these people telling you all of these things. They do have the power. They can ask for these things. They can ask questions. And IPOL, which we've talked about, Idaho Parents Unlimited, does a really good job of talking parents through this stuff. I would go to every IEP meeting if I could.
Jami, what are your thoughts kind of thinking of school for those kids, if they have opportunities at school to do speech therapy and then also private? How can that work together?
Yeah, speech therapy at school. I love schools, but they are overburdened, right? They are overburdened, period. So they're doing what they need to do, right? They're offering these services. They're trying to help these kids. It's not enough. These kids need to be in private therapy too. It is not enough. So anytime a parent says, yeah, they're getting speech at school, I say, that's great. I love that there's people there that are seeing these kids in their daily routine of school and helping with things there, but it is not enough. They need to be in private therapy too. And a good speech therapist is talking with the school speech therapist. You know, I have a speech therapist. She was working on some stuff. We had written similar goals and we just divvied it up. She was like, I'll work on this stuff at school. And I was addressing other things privately. So I always tell parents they're doing a good job by getting speech therapy at school. We just need to add more.
What other thoughts or questions do you have? And Hongyan, thanks for putting IPOL's contact info in the chat there.
Yeah, I'm looking at one of Amy's comments. Yeah, she's right. There's a lot of kids that fly under the radar, especially girls that just fly right under that radar. And then, you know, what we see as the sophistication of like communication increases. It's usually, for me, what I've noticed is that 4th, 5th, and 6th grade transition. Right in there is where we start to see that line with their peers. The peers are taking off socially, and those kids with autism just aren't able to maintain kind of that social language. So yeah, and they do. Those little ones will fly right under the radar, especially if they're good, if they don't have any behaviors, right? And it's like, oh, they're all right. They're fine.
Jamie, Elena was asking, how often do SLPs integrate social skills or social skills group in their practice?
Yeah, we do. I've always done that, integrated that in. I don't know clinic to clinic, how that's managed, but it's really important. Like we can sit in a room and I can teach social skills or talk about them, but unless you get to practice, the generalization of those skills just is super tricky. And what do children with autism struggle with? Generalization, doing things situation to situation or at different places. So you want to be able to do that. It's super important.
Jami, can you talk a little bit about telehealth delivery of speech versus in person? Because we have such a shortage of speech language pathologists in Northern Idaho that a lot of our schools have gone to telehealth delivery, and anything that you could say about that would be great.
Yeah. I have mixed feelings about telehealth delivery too. I feel like that I should have a t-shirt that says I have mixed feelings. Because I do about everything. We learned during COVID, telehealth became really essential, right? So we got to trial telehealth a lot with kids. I will say that I think kids with autism, sometimes telehealth can be really beneficial because it's less scary than being in a room with a person. It's less intimidating. Sometimes just taking that piece of sitting with a human being away, they can work on some of that stuff a little more readily. I think it works better for older kids. I think it's really hard for little kids, telehealth stuff. I unless their parent is sitting right there with them, I think it's tricky. So I think it can be really beneficial. Just depends on the kid and the age of the kid.
Thank you, Jami, so much.
Yeah, sure.
I think we've got a couple of minutes, but it looks like we might be done with questions. Just give a short pause. Okay, that is kind of nice to have a breather. We often are right at the hour. Thank you, thank you. So we hope that you all will be able to join us again. We're going to meet again September 26th from 12:30 to 1:45 Mountain Time. We have a guest presenter, Dr. Brittany Blockman, and she is the medical director of St. Luke's Children's Integrative Medicine Clinic. The topic is supporting parents who wish to explore complementary and alternative therapies in autism. So we had a lot of, throughout the years, we've had a number of people in feedback asking for this presentation, knowing that parents sometimes are looking for other therapies. And so we're excited to have Brittany Blockman coming on the 26th to talk about that. So thank you. For those that are part of our STAT QI cohort, hang on for a moment. Hong Yan is going to be opening a break room for us to go in that break room. For the rest of you, sign off. Have a great day. And thank you, Hong Yan, for putting the CME information in the chat. And we'll see you on the 26th. Thanks so much.